Every day, people make health decisions before ever seeing a doctor. They make them in group chats, in comment sections, and through people they trust. And sometimes, those decisions are based on information that isn't entirely true. And that has consequences, real ones. People skipping treatments, avoiding vaccines, mistrusting doctors, and dying from conditions that were entirely treatable. So that poses the question, what is the biggest threat to modern day healthcare? I'm here to say that it isn't a simple lack of medicine or research, rather, it's medical misinformation. And not the simple kind of people getting confused, but the kind that actively eats away at trust in the healthcare system. Because once that trust is gone, even the most impactful of medicine loses its impact. What makes it especially dangerous is that misinformation doesn't spread randomly. It's amplified by the systems we use in today's society to spread information. So before that, I want to preface that misinformation, people don't trust it because they're irrational. They trust it because it comes from people they can trust. Most health information doesn't even start in the hospital or research papers anyways. It starts in those environments where trust already exists. Growing up in a South Asian community and a very large South Asian family, I've witnessed how misinformation spreads through family networks and through WhatsApp groups, not as rumor, but as genuine advice given from people that care. I've witnessed my family members skip seeking treatment because of what another relative had told them. And because my parents are educated, thanks mom and dad, I've had the unusual position of seeing both sides of this issue, knowing what was wrong, yet seeing my loved ones believe it anyways. And that's what makes it so hard to push back on. When the person providing this information loves you, calling it wrong feels like calling them wrong. And this is even worse in communities where trust in the healthcare system is already on a decline. A Kaiser Family Foundation survey found that 44% of Black American families trust the US healthcare system, whereas 55% of white American families trust it. When institutional trust drops in the healthcare system, people don't stop looking for answers, they just switch their sources. Lower trust in formal institutions leads to a higher reliance on informal networks. Your family, your friends, your community members. These people aren't picking misinformation over medicine, they're picking familiarity over authority. But family networks can only explain so much. I mean, the sheer scale and speed of misinformation today needs an entirely new explanation. Social media. Because these platforms aren't designed to uplift the truth, they're designed to keep you engaged. An MIT study found that misinformation was retweeted 70% more than factual ones, and they spread significantly faster. Fear travels faster than nuance. Certainty travels faster than complexity. A single viral post can reach millions before a doctor even knows it exists. And by the time the corrections go up, it's already affected the decisions of so many. Social media didn't create misinformation, it gave it scale. You guys feel uplifted yet? No. So maybe we've been asking the wrong question. Instead of asking, why do people believe in misinformation, let's ask something harder. Why is misinformation easier to reach, easier to trust, and harder to correct than the truth? It isn't an issue with people's judgment, it's that the systems around us are built to amplify and make misinformation win. The problem isn't a failure of judgment, it's that misinformation is easiest to trust in those environments. When misinformation starts spreading faster than medicine, it turns from a communication issue to a public health crisis. Misinformation is rooted in the places where people have trust, and because of social media and other factors, it's able to reach farther than ever. So, what can you do? Well, the next time you see a dramatic medical claim online, pause and ask yourself an important question. Who benefits if I believe this? And if you see anything misleading, don't just let it sit. Point towards people that are credible. Point towards doctors, towards researchers, and towards public health officials doing work in their fields. Somewhere out there right now, someone is reading a message from a person they love about their health and deciding what to do next. What happens next depends entirely on what's already in the conversation. Because if misinformation can be rooted and reaching, so can the truth. Thank you.